agenda, we do actually have the COVID-19 interventions. There will be a discussion session, which is question answers. The next item will be committee business. If you can scroll down, Secretary, we do actually have the consideration of the draft program, and we're actually hoping that we can maybe have a look on the consideration of minutes in the committee business. I hope members will be able to actually accept that we proceed in our today's meeting in that order. Can I actually then present the program before the members for acceptance so that we can proceed? Honorable members.
I move the adoption of the agenda as tabled.
Thank you very much. Can we check if ever there's any?
I second the adoption of the agenda.
Ms. Mutawung, Chair.
Honorable Mutawung, I hope there's no objection. Honorable members, can we then actually proceed to the agenda as adopted? Secretariat, I just said check if ever there's any apology.
Chair, the minister and the two deputy ministers submitted the policies. Chair, the minister is attending and the deputy minister is attending a cabinet meeting, Chair, and one deputy minister has a family bereavement, Chair. So they submitted their apologies today, Chair.
Yeah, I did actually get the communication, and we do have the DG who would actually be making the presentation, and there is actually the chief economist that will be working with the DG around the detail of the presentation, Steve Ovo Hanival. And can I then actually invite the DG to actually take us through the presentation? We note those apologies. DG, sorry. Good morning and welcome.
Chair, I'm sorry to interrupt before the DG starts, but may I just ask a question just on this, because this is breaking news. May I just address you on this matter?
Well, I would actually ask you to speak to that issue. Let's hear what issue you're raising, thanks. Honorable McPherson.
So, thanks, Chair. If we're going to be discussing, to date, government's COVID response measures and expenditure on that, what the department has done, and so on and so forth. Right at the very beginning of this process, we were given an assurance that the minister would be dealing with this, that we would be able to interact and question the minister on these sorts of things and government's response in this respect. Now, to date, in my opinion, that really hasn't happened, and the government and the minister has been thin on actually answering questions about government's response to date. So, with no disrespect to the DG, it's the minister is the political head. He is the extension of cabinet for this committee, and really, it's not good enough that not him or one of two deputy ministers cannot answer to the questions that we may have on the government's response to COVID and money that may have been spent. So I really want to register my very extreme disappointment and frustration that here we are again unable to question the minister on COVID response. It's not acceptable.
I think we have had some discussion on that issue, but I think can we then actually proceed to take the presentation? I'm sure we can follow up on the issue of your comment. We did actually receive the apologies, and I think in terms of engaging the minister, it's an issue that we have spoken about before. We will actually pursue that, and I think it's quite important that when the minister is attending, we will be able to actually take the process forward. But at this stage, we will actually accept the apology and ask that we proceed with the presentation by the DG. And if ever there's any issues that would actually come up, I'm sure the minister will be able to actually respond in writing on the issues we will raise in our portfolio committee. Secretariat, DG, I think we can proceed with the presentation. We note McPherson's comments. I'm sure we'll follow through on that issue. Thank you. DG, floor is yours.
Good morning, Chair, and good morning to honourable members. Let me firstly take this opportunity to really thank you, Chair, personally, and the committee for the guidance and support during this really critical period, this past 5 months. Chair, as you know, we've had a comprehensive, a multifaceted, multi-pronged approach as a department, and we hit the ground running as from March to change our strategy, our activities, and our interventions to deal with this unprecedented crisis. So, Chair, I'll be very brief. The detailed presentation will be done by our Chief Economist, Stephen Hannibal. But let me just say that throughout, our overriding objective with the multiple interventions, from competition interventions to consumer commission, to support for distressed firms, to assisting international travelers to come with regards to investment and so on. The overriding objective is, I think, is what Ernest Oppenheimer, the founder of Anglo-American, said during the Great Depression and after the Spanish flu. He said the key job was to preserve the company so that after the depression, they can stand up and operate. So our primary purpose has been to preserve our industrial base during this period so that when the recovery comes, which is now, we are able then to get business and get the industrial champions moving. So that has been the overarching objective. And I think we hopefully have more or less kept our industrial structure in place, even though we've suffered tremendous damage. And many of the companies are standing with excess capacity and obviously had to do some pullback on investment. But we hope we've preserved the essential industrial fabric. On that introductory note, let me hand over to Stephen, and then to allow them to load the presentation. And then, as I said, we will be available then to take any questions. Thank you, Chair.
Okay. Thank you. Anupam?
Thank you very much, Chair. I'm just opening the presentation. I hope that's visible to everyone, Honourable Chair.
Yes, we can see that, yes.
Okay, great. Thank you very much, and good morning to you, Honourable Chair, as well as to the other honourable members. Thank you very much for giving the DTI an opportunity to come and provide we hope you'll feel a comprehensive briefing on the government and specifically the DTIC's response to the COVID-19 pandemic. Chairperson, you'll recall that we last presented to the Portfolio Committee on COVID on the 22nd of May. And so we thought we would just give a very high-level recap of those discussions. And then for today's presentation, we thought we would go through some of the global developments. We'll touch on the key developments in South Africa in terms of the infection rate and the spread of the virus. And then the heart of the presentation is really the 9 broad interventions that the DTI has been involved in, and that now includes the economic recovery. As members will be aware, there are discussions in multiple fora around what South Africa needs to do to put the economy back on a strong footing and to undo the damage that's been caused by the pandemic. And then, Chair, we have quite a few slides that we've dropped into the annexures, which provide a lot of detail in terms of some of the Competition Commission cases, some of the Consumer Commission cases. We didn't want to overburden the committee with all of that in the presentation, but they are in the annexures, so they can be discussed if the committee feels it's appropriate. So, Chair, just to recap, on the 22nd of May, the DTIC presented to the Portfolio Committee. At the time, we framed the challenge around COVID really as one of deep economic potential damage. I think we're beginning to see the extent of that. It's also fair to say that South Africa is not alone in experiencing this damage. A number of European Union countries indicated their GDP quarterly data, their Q2 GDP numbers this week. And overall, most of those countries, including Germany, the United Kingdom, Spain, Belgium, and a number of others, the overall GDP quarterly number is a -8 to -10, -11% decline. So we're aware that the impact overall is going to be significant for South Africa. The Q2 GDP number for South Africa will come out in September. So we also then talked a little bit about South Africa's response to COVID-19. We presented on the economic impact and mitigation, and then we went into, I think, quite a bit of detail around what were the measures that government as a whole and the DTIC in particular would be implementing to mitigate both the social and economic damage that we expected to see. Then we also presented in some detail the regulatory interventions that were provided. This was in the form of the regulations, the exemptions in terms of the Competition Act that would allow firms to cooperate in producing PPEs, cooperate in terms of alignment in terms of supply chains, as well as providing support to consumers and workers that would be that we expected to be in distress. Then we also talked a little bit about protecting consumers, and in particular the action that would be taken where price gouging, unreasonable price increases became visible. And then finally, Chair, we touched on the risk-adjusted strategic approach. And of course, as members will be well aware, we've now moved from level 3 to level 2. And so we'll just talk in this presentation very briefly about what that means. So portfolio committee members then just touching on the global developments. This is a slide that members will have seen before. It's the number of COVID cases per million people. And we're really here just showing the extent to which South Africa has been affected and how a number of other in many cases, developed countries have similarly been affected. You can see South Africa is essentially on a par with Spain, with large parts of China and Russia. And so we see those challenges as well. Of course, we are not in quite the same situation as the United States and Brazil. So we're relatively fortunate there. But as a infection rate per million people, we have got a reasonably high number. Then just to go to the daily confirmed cases, this graph really gives you a sense of where the thinking around government being able to move South Africa from level 3 to level 2 comes from. This is the daily confirmed cases per million people, and it's smoothed by looking at the 7-day rolling average, so that even if you do have some tests that have been completed, but the results are not yet available, that sometimes gives you spikes in terms of number of infections. So we smooth the data by looking at a 7-day average, and you can see here that South Africa has been seeing a slowing of the number of new cases per day for a couple of weeks now. And that's really given government the space to be able to move South Africa as a whole from level 3 to level 2. Then, Chair, many colleagues will be aware that South Africa's rate of infection is relatively high. We are either the 5th largest or the 6th largest country in terms of infections. However, where we have done exceptionally well and we've been very fortunate is the case fatality rate. And here you can see South Africa is right down at the bottom in red. And our case fatality rate has been very low. Now, honourable members, many media sources will say, well, perhaps the fatality rate has been underreported. That is a possibility, and we have to continue to look into that. Members will be aware that the Department of Health has issued a directive to all funeral parlors to indicate the cause of death much more accurately than in the past. So there's an attempt to really get an accurate sense of the extent to which people in South Africa are passing on as a result of COVID-19. But nevertheless, our fatality rate, even if it's a little bit higher than the 11,000 formal number, official number, is still likely to be very low compared to other countries, and in particular compared to other developed countries. This slide just gives you a sense of the extent of infections on the African continent. As you can see, South Africa's over here on the right-hand side. We still account for a relatively large share of the infections on the continent, just probably under about 50% or so. But of course, we are at a different stage in the infection cycle compared to many other African countries. And it is also the case that because South Africa is relatively open to foreign travelers, both tourists and business travelers, we probably experienced a significant increase in infections as a result of foreign nationals entering South Africa before the borders were shut. It may well be, we hope it isn't, but it may well be that other African countries will experience a similar increase in infections probably over the next couple of weeks and months. Then, honourable members, if I can take you to some key developments in South Africa. This is primarily still on the infections level. This timeline just gives you a rough sense of where we've come. It feels like we've been fighting COVID-19 for a few years, but actually it's just been a handful of months. You can see in this slide on the 19th of March, the confirmed cases crossed the 100 infections level. On the 26th, the 3-week the first national lockdown began. And then more recently, on the 22nd of June, South Africa surpassed the 100,000 mark for infections. Members will recall on the 23rd of July, as it appeared that we were approaching the surge or the peak, the president announced the temporary closure of schools. And on July the 25th, we had what remains the highest level of daily infections at 13,944 new cases. If you look more recently in August, and this is really where, as I was indicating earlier, we've had the policy space to be able to consider moving from level 3 to level 2. On the 12th of August, you can see the daily new cases had slowed to a still positive number. So the cases were still being found in South Africa, but a much slower daily increase of just 2,800 new cases for that particular day. And then, of course, on the 15th, the president announced that we would be moving to level 2. This slide just summarizes some of that information. Global infection level as of the 17th of August was about 21 million people. South Africa's infection level just over 500,000. And as I indicated earlier, our deaths remain thankfully on the low side, but unfortunately 12,000 South African people still lost their lives. This just provides a little bit more detail. Chair, you may notice some discrepancies in terms of the numbers. The total deaths here is 11,982. This is because we are using multiple sources for us to be able to compare South Africa's progress versus the rest of the world. But those discrepancies are relatively small numbers, and generally they are updated as the WTO updates their information, their data based on South Africa's data that is submitted by the National Department of Health. Then just in terms of, again, comparing South Africa to the global environment, this is the number of cases per million. And I think honourable members will have seen this previously. It's been coming down quite significantly. And that's obviously what has given government the space to move us from level 3 to level 2. This is just the provincial picture. I won't go into it in any great detail. This is the provincial picture based on 1,000 population. So it gives you a sense of how many infections we have per 1,000 in the various provinces. And you can see we've been very fortunate that a number of provinces have very low levels of infection compared to the size of their population. And for that, we're very grateful. We obviously do believe that the lockdown in all its various forms has succeeded in helping us to maintain the infections at a level that doesn't overwhelm our hospital resources. Then, honourable members, if I can take you to the DTI's key interventions, the 9 broad interventions. The 9th one is really dealing with how the department has managed outbreaks within the DTI campus and among staff. The first 8 really deal with broader issues around how we managed to mitigate both the social impact and the very severe economic impacts that we've seen and that are continuing to emerge as the virus takes its toll on the country. So, honourable members, here you'll recall that the President announced the 500 billion rand coronavirus intervention budget. We've detailed here some of the key elements of that. The first is the 100 billion with another 100 billion available, so 200 billion in total loan guarantee scheme that's being implemented along with the major banks, National Treasury and the South African Reserve Bank. I think it's important that we signal here as the DTIC that our budget has not been impacted by this loan guarantee scheme. This scheme runs directly with the commercial banks and individual companies that might be in distress or entering distress. So as the DTI, we haven't accessed any of the 200 billion. This is 200 billion that the commercial banks are to loan directly to companies, firms, SMMEs that are in distress. You'll have seen there's a lot of reporting on this at the moment. It's been a little bit slow to get off the ground. Our colleagues in National Treasury and the Reserve Bank are working to improve the management of the scheme, the implementation elements of the scheme, to make sure that it does meet its target. Some of the other elements are the 100 billion rand for the UIF, the TERS benefit, the temporary employment scheme, as it's called, and we'll talk a little bit about the extent to which those funds have flowed. Then there was 70 billion rand in cash flow relief that was announced. This is essentially a holiday for companies in terms of paying their skills development levy contributions, as well as fast-tracking VAT refunds and a number of other interventions. There are then also a few interventions that targeted specifically the social economy side. So the 50 billion that was allocated to provide support to individuals who perhaps were not able to work, or partly because of the lockdown, partly because there's simply a very limited demand for casual employment at the moment. Here we're talking about essentially construction workers, workers in the informal retail sector. So funds have been provided for that. And then there are also a number of funds that have been provided specifically to SMMEs and spaza shops, such as the 2 billion that was announced, as well as some support through the Department of Tourism. Then, honourable members, to head straight into the specifics of the 9 interventions. The first one, you'll recall, was around health stocks. The key issue at the time in late February, early March, when the magnitude of COVID-19 became obvious to us, the key issue was that we needed to ensure that South African health workers, that the South African population, anyone that needed to attend a hospital would be able to find a hospital bed, would be able to get access to oxygen if required, and that workers would have access to personal protective equipment. So some of the interventions here was the DTI providing around about 500 million rand from its budget, the 2019-20 financial year budget. We provided those funds to the Department of Small Business as well as the IDC. The IDC funding went into assisting companies that could very quickly ramp up production of these essential products, whether they're PPEs or pharmaceuticals or medical supplies. And the 250 million that was provided to the Small Enterprise Department through CIFA was to assist SMMEs. In addition, we also began work on the National Ventilator Project. This was really a brainchild of the Minister of Trade, Industry and Competition and the Minister of Science and Innovation, because it became clear very early on in the pandemic that our developed country partners were experiencing significant challenges in terms of having sufficient ventilators. And the risk for South Africa was that we simply wouldn't be able to import ventilators if the need arose. We were not producing in any significant numbers ventilators in South Africa. And so there was a big push on how do we ensure that we have access to ventilators when the need arises. And it's a theme that we'll return to later in the presentation. Then, as I indicated, the IDC provided very quick turnaround times in terms of approvals to provide funding to companies that were able to either were already operating in the medical supply chain or the PPE supply chain, or were able to retool and enter that supply chain to increase supplies into South Africa. The Solidarity Fund, members are well aware of, we'll touch on it very briefly later on, and then also the issues around getting companies in the clothing and textile sector to retool to produce face masks and other PPE because the need for those products was growing exponentially. Lastly, very important, the work by the Competition Commission and the National Consumer Commission to ensure that we didn't see price gouging, and where we did see price gouging, investigations could take place very rapidly, and interventions, fines, regulatory interventions to ensure that that consumers were not disadvantaged by these unfortunate acts by primarily firms. So, honourable members, here it's a little bit more of the detail around some of these interventions. You'll probably be aware that the regulatory authority in the health sector, SAHPRA, had a backlog of some 2 years in terms of applications for certification of medical devices as well as pharmaceuticals. There was a real risk that some of the new developments around surgical masks, around the ventilator, would also be held up in that regulatory blockage. However, we've been able to work very closely with SAHPRA as well as our colleagues in Department of Health and with the companies involved to ensure that SAHPRA has been able to provide certification with a much shorter turnaround time than was the norm previously. I've touched on the issue of clothing and textile companies retooling to enter the PPE market. Here, DTIC worked very closely with the Southern African Clothing and Textile Workers Union and a number of companies to really develop their capability to produce masks, face shields, and a number of other similar PPEs. We've also been working with companies because we noted the shortage of diagnostic kits. So we've been working with a number of companies to see whether they're able to localize production of those diagnostic kits. Unfortunately, a large part of the value of the diagnostic kit is imported into South Africa. It's a relatively very tight supply chain. And so we're investigating that with the Medical Research Council and our colleagues in the Department of Science and Innovation. And then there have been a number of other interventions also with multinationals to try and see if we're able to convince them to put up investments in South Africa. Of course, a key part of making sure that we manage the stocks was ensuring that we were both able to continue importing and also so as not to beggar our neighbors in a sense, we needed to make sure that we were also able to export critical products to our neighboring countries, which were also battling the COVID pandemic. So on the import side, we ensured that there were certificates issued in good time for the rebate of the full duty. We needed to make sure that that especially where we were not able to produce the product locally, there was no cost-raising effect by leveraging imports or VAT. In addition, we then also made sure that the duties were rebated where solidarity type organizations, charitable organizations were importing either PPEs or pharmaceutical medical products for local use. On the export side, of course, we needed to make sure that we managed our stocks very carefully. We had in place a very close relationship with the medical sector in South Africa, so we were able to see almost on a daily basis the extent to which the stock of gloves or surgical masks or ventilators was being either exhausted or was in surplus. And so we were able to manage the export restrictions based on the extent to which we felt that South Africa had adequate supplies, adequate stocks. And of course, it was critical that we ensured that we not disadvantage our neighboring countries, particularly in SADC, where an export control mechanism would have resulted in those countries not being able to access PPEs, masks, pharmaceutical products, paracetamol, and the like. We think we've done that relatively successfully, and we've maintained good relations with our neighboring countries in that process. Then, honourable members, very briefly to touch on some of the IDC funding. I think you've seen some of these numbers before, so I'll just pull out one or two of them. So we've approved around about 12 applications at a cost of about 476 million in terms of the IDC Essential Supplies Intervention Program. This is the program that provides funding to companies to ramp up production. And you can see a little bit lower down on the slide, as a result of the IDC funding, our capability in South Africa to produce the N95 surgical mask, this is the mask that keeps out at least 95% of pathogens. Our capacity to produce has increased by 1 million masks per month, really significant increase. On surgical masks, we've been able to increase manufacturing capacity by 16 million masks. And then in terms of hand sanitizer and disinfectant, we've been able to increase by 2 million liters per month. I should mention that, of course, one of the challenges here is it's not just about increasing production, it's also then about ensuring that government procures from these suppliers, these local suppliers, which have been able to make the investment to ramp up production. There are still some challenges in that area, as I'm sure honourable members will be aware, and DTIC continues to play the role of the champion of local production within government overall. Then, honourable members, if I can take you very briefly through the National Ventilator Project. As I said earlier, the DTIC and Science and Innovation conceptualized the project when it became clear that we may run out of ventilators in South Africa. The one thing that was very fortunate for us and was a direct result of the lockdown and being able to flatten the curve was that we were able to delay our spike, our surge in infections. And as a result, we were able to learn from the clinical experience in other countries like China, Italy, the UK, and the US, where the experience was that the very invasive approaches to providing respiration support to patients actually was quite negative. And in many cases, it was very difficult for those patients to recover from COVID-19. What those clinicians experienced was that, in fact, a non-invasive approach, what's called a continuous positive airway pressure device, or a CPAP, had the greatest potential to save lives of people severely infected by the virus. So government as a whole spoke to our colleagues in SARO. This is the group, the engineering and systems group responsible for the SKA telescope. We're able to discuss with them the processes to very rapidly prototype a number of ventilators. A call was put out for proposals. 100 proposals were received, those were evaluated, and obviously a key requirement was to say that we needed to make sure these ventilators could work both in a private hospital as well as in a field hospital. So they needed to be robust, they needed to be able to manage sometimes dusty environments, non-sterile environments. And then, of course, we would need to take those devices through the medical products regulator separate to ensure that the ventilator met those requirements. We're very pleased to be able to tell you that the assembly of this device is now taking place at a company just outside of Cape Town. It includes components from 8 different supplier companies right across South Africa. And we believe that we're able to now, with quite a bit of confidence, report that we are unlikely, based on the current projections, to experience a significant shortage of ventilators, even during a potential second wave of the virus. We've also been able to ensure that the product is produced almost exclusively based on South African skills, South African companies' production. So it's a really local product. And we have just a few pictures to give you a sense of what we're talking about. The top left is one of our healthcare professionals holding the mask that's put on the patient's face. On the top right, you can see the device, the part of the device that manages the mix of oxygen, the extent to which oxygen and just ordinary air is mixed before that's pumped into the patient's lungs at a pressure that can be adjusted based on the extent to which the patient's lungs are still able to operate. The bottom right is a picture of the assembly line where the ventilator has been assembled. And on the bottom left, you can see our healthcare professional in South Africa measuring how much oxygen to and the pressure to apply for the patient that's receiving the assistance. Honourable members, I'll then go to the second broad area. This is really around ensuring that not just in terms of PPE and pharmaceuticals, but in particular that we were also able to continue to ensure that South Africans could feed themselves, could feed their families over this period. The intense first lockdown had the real potential to disrupt food supply chains, even though those companies were permitted to operate at level 5. The challenge was still to make sure that those companies could get through in terms of their supply chains, access their input markets, and then get product into retailers and wholesalers for sale to South African consumers. So here we worked with a number of companies, we worked with a number of industry associations, such as the Consumer Goods Council of South Africa, and also we used the opportunity to encourage localization of production wherever we could. Here we provide just a few high-level examples. These are by no means exhaustive, and honourable members may have seen one or two of these already. For example, we worked with Sasol to ensure that ethanol and alcohol supplies would be available to the producers of sanitizers and disinfectants. We also assisted poultry producers to ensure that they could move chickens across the provincial borders when those were closed under lockdown level 5. And we also worked with, and it's a theme we'll come back to later on in the presentation, we also worked with key importers of medical supplies and PPEs who were struggling to get, including sometimes donated product, through the international airports, particularly in Europe, in China, in India. They were battling to get these flights to South Africa with these critical products. And we worked very closely with a number of enterprises companies that were donating product to South Africa, and then also with our Department of Public Enterprises and SAA to ensure that the stocks were able to arrive in South Africa in good time. Here are a few more. I think one area that we'd like to perhaps just pull out is the portal that Proudly South Africa has set up along with business. This is a really helpful initiative to ensure that where local procurers need to access PPEs, the masks, etc., they actually know where the companies exist. So they can go onto the database, the platform, find out where the companies are located, make contact with those companies. They have a sense of what the company can produce, the volumes that the company can produce. And we found that this is really critical where in some cases, local procurers were saying, well, they can't access these companies. They don't know where these companies exist. And so we think that's been a very positive intervention, working closely with Business for South Africa and business overall in this area. This is the slide I was alluding to earlier, honorable members. This is around where we've worked very closely with companies to get product into South Africa, but also companies like Mercedes-Benz in order to continue the momentum around the Autos Master Plan. There are some critical engineering system specialists that we simply don't have the skills in South Africa yet, where we needed to assist the company to get these experts into South Africa to be able to continue the Mercedes-Benz investment in South Africa. So a number of those kinds of interventions across a number of companies, and we feel that that augurs well for South Africa's recovery. Then, Honourable Chair, the third broad area is around solidarity and social protection. As I alluded to earlier, we knew that the heaviest impact was going to be on workers, on people that were made unemployed as a result of the lockdown, and we also knew that companies would face real challenges and that we would need to provide urgent support to mitigate those impacts. So here we've got a little bit of information on the UIF, the Temporary Employment Scheme that I alluded to earlier, and we can confirm that around about 40 billion rand has now been paid out to workers, including workers who were not actually members of the UIF scheme when the pandemic struck. This is a special measure that's been implemented by the UIF and our colleagues in the Department of Employment and Labour, specifically to assist those workers who, for a variety of reasons, had not been contributing to the UIF. Their employers, in many cases, were not contributing to the UIF, but they've been heavily affected by the pandemic. And we think this has had a really major impact. Of course, there are still challenges. The numbers of applications that are being processed by the UIF is really high, almost unprecedented in the UIF's experience. And so there are still some teething challenges, but progress is being made and money is getting out to deserving and in many cases desperate workers in South Africa. Then we've also worked very closely with our colleagues at the National Economic Development and Labour Council, where we've assisted as we've approached the different lockdown levels. We've worked with our colleagues there and social partners overall to ensure that workplaces are ready and were made ready for workers to be able to safely return to work. And a number of directions and protocols were developed in that area. Honourable members, the one thing that we have to signal here is a very worrying rise in the number of what's called Section 189 notices. These are the notices that firms have to lodge with the CCMA before they're able to start retrenchment processes. And unfortunately, we note a significant increase, around about 190 large-scale retrenchment 189 notices were served just in July, and 1,300 small-scale retrenchment referrals. And we think this is a very worrying phenomenon. We are working very closely with business and our social partners in NEDLAC on the economic recovery plan to really try to head off what might become a significant level of retrenchment. Then just some more specific information. The National Empowerment Fund is an important part of the DTI. It's also been implementing a number of short-term intervention measures to assist companies. The first is that it's put out a call for the Black Business Fund. Over 500 applications have been received, and to date 28 projects have been approved. This is primarily to assist companies which were able to ramp up, Black-owned companies that were able to ramp up production of medical supplies, PPEs, pharmaceuticals, etc. And 174 million rand has been approved for these 28 projects. And quite critically, during this time, we have to ensure that the money actually gets out of government and into enterprises that need the funds to be able to continue operating. So quite importantly, 60% of the approved funding has already been dispersed. Then in addition, the NEF has also provided a short-term repayment holiday to firms that have been affected by the pandemic. So in total, it's postponed around about 30 million rand in capital repayments. And in addition, and this is a little bit different to what the commercial banks have done, commercial banks have provided loan holidays, but the companies continue to pay interest on the extra loan period. What the NEF has done is to provide zero interest loans for those repayment holidays, which is quite a significant improvement and really assists enterprises to weather the current storm much more effectively. And then just for the DTI's own incentives, of course, there are a range of deadlines where companies have to submit claim information by a particular turnaround time to ensure that we're able to verify that the assets have been purchased, etc. Those claims have now been extended so that companies are not disadvantaged if they are not able to get their claims in on time. Then the fourth area was around the regulations and the directions that were issued by DTIC. You'll recall the department needed to assist in issuing specific regulations around how auto retailers as well as auto companies providing repair services could operate at alert level 4. There was also significant engagement with business around the clothing, footwear, and bedding retail activities at level 4. And then, of course, members will recall very well the e-commerce issues and the DTI's issuing of regulations to allow e-commerce to operate fully earlier on in the process. There's no real new regulations and directions in this area, so we don't have anything further to say there. The only new regulation is around the steel sector, and it's a theme that we'll come back to right at the end of the presentation. Then, members, the fifth broad area was around protecting consumers. You'll recall, as I said earlier, we needed to make sure that firms didn't take advantage of the pandemic to increase prices unreasonably, and in particular to increase prices where their inputs had not increased. Regulations were issued by the Minister of Trade, Industry and Competition early on in the pandemic, indicating exactly how those would be assessed. And unfortunately, companies still went ahead and increased prices unreasonably. And so we have some information on how we have dealt with that. Since the last portfolio committee, a number of cases have been finalized. The Commission has referred, the Competition Commission in this case, has referred a number of cases to the Competition Tribunal, all of these relating to excessive pricing in face masks, surgical masks, hand sanitizer, and also basic food products. And the Tribunal has confirmed 30 consent orders in favor of the Competition Commission, which has resulted in fines. And we also felt that there was a need to ensure not just fines, but also that donations to the Solidarity Fund and other charitable organizations could be the recipients of these consent orders and settlement orders. So we provide a little bit more detail here, and there are a number of slides in the annexure that provide quite a lot of detail. Here you can see the Competition Commission and Tribunal dealt with a number of firms that are engaged in excessive pricing, price gouging, and you can see the administrative penalty collectively was about 15 million rand. You can see the individual companies and the penalties that were prescribed, as well as the donations that those companies were required to make as well. And we've got quite a bit of information here. You can see a number of cases across a broad spectrum of companies. Then, in addition to that, we also needed to make sure that our National Consumer Commission was responsive to complaints from consumers. And you'll recall that we set up a toll-free helpline in March already, so very early on in the crisis. We also set up a Twitter account that South African consumers could use to raise complaints and also to ask questions of the Consumer Commission, get advice from the Consumer Commission, and then a number of public awareness campaigns were conducted as well. We can tell you now that around about 3,000 calls were answered. Of those 3,000 calls that were answered, 1,900 calls related to price gouging, and those were passed on to the relevant authorities. And then the remaining 1,200 calls were not related to these matters, and in many cases were then referred to the appropriate other departments or other regulators. For example, in many cases, the complaints were around workers being forced to return to work without the company having adequate protective measures in place. And in those cases, we referred those matters to our colleagues at the Department of Employment and Labour, which is where the Labour Inspectorate resides, and they were able to take action, not punitive action, but action to assist firms to meet the requirements of the regulations that have been passed. So here we just provide you with a further update of some of the complaints. 85 investigations have been completed, 16 matters were closed, 10 matters have been referred to the tribunal. Not all of them have been finalized, but a number of settlements have been reached. And here we provide you with more detail around some of those settlements. In particular, it's worth pointing out, honourable members, that in many cases the settlement agreements involved firstly an administrative fine, but then also a donation of PPEs. As you can see, for example, at the bottom of the slide for the People's Pharmacy, there was an administrative fine, but then we were also able to negotiate that the company would provide PPEs to the Gift of the Givers. We know that that's a charitable organization that was able to get support to those most in need of it, as well as to donate to the Katiwe Rehabilitation Center for children with disabilities. And so we think this approach ensured not just that we were able to send a strong message to the companies by leveraging an administrative fine, but then also by ensuring that those companies needed to donate to organizations working on the ground to get support to those most in need as quickly as possible. Then, honourable members, in terms of global coordination, of course, during a crisis, a pandemic such as COVID, there's always the risk that a developing country like South Africa is at the end of the queue in terms of accessing active pharmaceutical ingredients, the key elements that go into making pharmaceuticals. A number of countries implemented export restrictions in that area. Also, you've seen in the press the reports of PPEs being redirected from one country to another country when the aircraft is being loaded with the PPE and it's literally about to leave. It's on the runway. There's also been a lot of reporting around vaccine development and countries, particularly developing countries, buying up those vaccines even before the vaccine has been developed. So our interventions in this area has really been about advocating within both the G20 and the WTO that all countries should have access to the necessary means to fight the COVID-19 pandemic, whether that's through encouraging the G20 to provide financial support and debt relief particularly to countries in Africa, as well as encouraging the G20 to do whatever it could to ensure that medical supplies continue to flow into countries requiring it, and then also sharing of the technology to be able to fight COVID-19. In general, we think that these positions have been well accepted within these structures. Of course, much more needs to be done. And then, of course, we've also engaged with our colleagues on the African continent through both SACU and SADC, making sure that we've continued to support our neighbors with PPEs, with food products, with pharmaceuticals, as they fight the pandemic. And I think we've been able to manage relatively well. We certainly haven't beggared our neighbors by putting up strong export restrictions, and also our platforms to monitor stocks in South Africa has meant that we can with confidence allow exports, because we know that within South Africa we have adequate stocks of those critical products. So we believe those have been really useful interventions, and we work very closely with our colleagues on the African continent. Honourable members, let me start wrapping up. Just the seventh broad area is around reopening the economy. These are issues that are well covered already. The President announced the consultations that he'd held around moving the economy to level 3, and then the consultations he held last week, including with NEDLAC and all social partners, around moving to level 2. And just to remind you, this is the slide around the risk-adjusted strategic approach. You can see at level 2, the issue is the moderate spread of the virus, but critically high readiness within our public and private hospitals, and of course our field hospitals, which have not been overwhelmed as a result of the COVID. And so we've been very fortunate, and as a result, we've been able to then reduce the restrictions on economic activity. The eighth broad area is around the reconstruction, the building, build it back better, as the President puts it. And here a number of themes are introduced. Of course, this is the first step in what will likely be a medium-term process. The damage done to the South African economy and to many economies across the globe is going to be quite significant. We've seen that in some of the unemployment numbers that have come through already. And we have a sense now from the GDP numbers that other countries that had lockdowns have reported, the -7%, -10% GDP numbers that we're seeing in the European Union countries. We have a sense of what it's likely to be in South Africa, and of course it is going to be quite significant. However, transformation has to remain as the core pillar of our reconstruction, along with infrastructure investment, and then dealing very decisively with the need for local production in a number of areas. We have to ensure that we reduce the import leakages on both private sector and public sector procurement if we're to grow the South African domestic market. Honourable Chair, very briefly, I've alluded to this earlier. The one regulatory measure that's been put out in the last month or so is the issue around scrap metal. Members will recall that the primary issue here is that our steel mills can't access scrap metal at good prices because most of South Africa's scrap metal is exported. And so we had the price preference system implemented for a little while. This was designed to ensure that steel mills were offered scrap metal first at a reduced price before the scrap was exported. Members will be aware that it's worked to some extent, but there are still areas where scrap metal is being exported without going through the price preference system. In some cases, these are illegal activities, and so we needed a strong intervention. We've been working for quite a while with our colleagues in National Treasury around implementing an export tax, which we believe is both the correct regulatory measure and is likely to be the most effective regulatory measure. And we're pleased to report that the draft taxation laws amendment bill, which will allow for this, is now out for public comment. It was issued on the 31st of July for comment, and we hope that we are moving quite rapidly now towards being able to finalize an approach in this area. Then just lastly, Chair, the ninth area that we added is how the DTI has been able to manage the outbreak of COVID-19 within the department, as well as within the DTI campus. Of course, we have tried to lead by example, and our minister, the deputy ministers, and the DG have really led the way here in ensuring that the department's able to operate remotely in many cases, and also that we've been able to manage the number of cases. So here you can see we've had 25 reported cases, 18 cases are active at the moment, and we've had 7 recoveries and fortunately no deaths. And of course, in the interest of transparency, we also wanted to just give you a sense of the DTI and the DTIC and its entity spending on, I see a typo at the top. It shouldn't be PPP, it's PPEs, it's the personal protective equipment. Here you can see exactly what we've spent. And as per usual, if honorable members wish to know the companies that have benefited, all of that information is readily available in the way that we ordinarily report. So, Honourable Chair, honourable members, thank you very much for the opportunity to present this update of the DTI's interventions to mitigate COVID-19. Thank you.
Okay. Can we then actually have the members taking comments and or questions? Thank you, DG and Chief Economist. Can we then actually allow the members, honorable members, to actually pick up on the comments and questions? Secretariat,
Chair,
do you have any hands raised?
we do have Mr. Cuthbert, followed by Mr. Mulder, followed by Mr. McPherson.
Cuthbert, Mulder, and McPherson in that order. Cuthbert, floor is yours.
Thank you very much, Chairperson. Excuse me for not putting my video on, but my signal's not too great, so it's just better if I do it this way. Chairperson.
Proceed.
Thank you, Chairperson. Chair, there's 2 issues that I would like to raise. Number one, the department comes here and parades the Competition Commission's exploits in making sure that, the capitalist pigs aren't, exploiting the masses, the way in which it's been framed and the narrative that has been driven. But there's been very little action subsequent to myself and Honourable Kachalia laying a complaint with the Competition Commission about price gouging at SAA for repatriation flights, where flights were, increased by over 100% in order to allow people to travel safely back to South Africa. And I find that to be a problem, that we take such a harsh stance on private companies, but we have done nothing to ensure that state-owned entities play by the rules as well. So that doesn't impress me when we come and say, well, we've made these people contribute to the Solidarity Fund and to, these corporate social responsibility measures, when they've done nothing to take action against something that falls under their direct purview, such as a state-owned entity. And we would like to see action on that front, Chairperson. The second issue that I would like to mention is regarding the scrap metal industry, Chair. Minister Patel has now gazetted a 2-month block in exports, and mills and foundries largely find themselves full with scrap and billets at this moment in time. So what informs that logic to block exports? Are they trying to run this industry out of business? Understandably, there's a challenge when it comes to, the stealing of cables and the like that gets given to scrap steel not manufacturers, but processors rather. And surely there can be a measure put in place to prevent stolen steel from being sold to these companies, rather than trying to, block off the market entirely. I mean, it seems as if they are following the North Korean Juche economic model by trying to protect everything in that respect. Same goes for the export tax itself. I mean, surely we understand that, market fundamentals in this particular industry are good for the industry, and we must ensure more competition to bring down the price of steel. And I don't understand why there's this continued push, despite the prevailing logic that this is not a good idea, Chairperson. I think that it's highly problematic. So I would like to please have a response on that particular issue.
Honourable Mulder.
Thank you, Chair. My question or comment would be about the regulations, specific regulations during the different levels of lockdown. I feel of an opinion that there's not sufficient information in the report about the regulations and exactly how they came about. You know that we've differed of opinion in the past about this, because the Freedom Front Plus is of opinion that a lot of these regulations were actually irrational and unnecessary, and that they were kept going for too long, with reference for the when the sale of hot food was prohibited, for instance. I feel that there should be more specific information in this report about the specific regulations and what they actually, what the unintended or intended consequences were. I would propose that we elaborate more on this. Thank you, Chair.
Thank you, Honorable Mulder. McPherson.
Thanks very much. It was an interesting presentation because everything that was put on the table was, in fact, Mr. Hannaville, entirely predictable. You will know that we entered into the pandemic with a recession already baked in. And there seems to be no discussion or no acknowledgement of all of the disastrous policy choices that have been taken going into the pandemic that have now played themselves out on steroids. So I want to ask a couple of questions. What action has the DTI taken against suppliers to government for price gouging? You've been very robust on the private sector, but you have not done anything on the public sector. And we know that cadres, comrades, and politically connected people have supplied health goods, PPE goods to through companies to many different departments at up to thousands of % increases. So what have you done about that? I disagree with you that the lockdown has succeeded, because the whole point of the lockdown was to build healthcare capacity. And we know outside of the Western Cape, not a single province was able to build healthcare capacity. The only thing that the lockdown did was to destroy the economy and force 3 million people into unemployment. So I find that sort of trumpeting of the lockdown as a success deeply insulting to the 3 million people who gave up their jobs and their livelihoods in the belief that government would play its part and failed dismally to do so. The loan scheme has been a total disaster. I think about only 10% of that loan scheme has actually been taken up. And many businesses do so or don't do so. And maybe this is important for you to know, Mr. Hannaville, because the banks require you to give double the assurity or double the value of assurity for the loan required. Now, what person can do so in a pandemic when their businesses have not operated for 3 months? And yet the DTI have done nothing. They've made very little engagement with Treasury. They've said very little. They haven't advocated for the changes earlier on that were required. They sat on their hands and watched this unfold. And it was obvious from the beginning that the requirements, the ordinary lending requirements, were just simply not going to work. Then I want to turn my attention to the much fawned about national ventilator project. Can you please answer the following questions? How many ventilators have actually been built and delivered to date? How many, so where they've been produced? How much money has been spent by government on the research, production and delivery of these ventilators. And I want to then just take you through a timeline around these ventilators. In April, the department said that 10,000 were going to be built by the end of June. In May, they then said 15,000 were going to be built by the end of July. In June, Minister Patel said that the ventilators were going to be delivered by the end of August. And just last week, the department said that they were going to distribute 10,000 by the end of September. So for months and months, this project has failed to get off the ground, to the point that the Western Cape said we don't need these because we've passed the peak. And by government's own admission and your own statistics that you put on the table, the cases are declining and deaths are declining. So who are going to use these ventilators and to what expense? And then lastly, Mr. Hannibal, I'd like to know, what was your involvement or views on the booze ban, the ban on alcohol that decimated the alcohol industry across the country and many wine farms across the Western Cape? I understand that you were central to this discussion. Did you support it? Did you lobby it for it to be lifted? Or did you, in fact, lobby for an extension of it? Thank you.
Can we pick up other members?
Chair, Ms. Mantashe, followed by Mr. Mbuyane and Mr. Three.
Honorable Mantashe. Mantashe. Mantashe, I'm sure it's just the meeting. Okay, can you check?
Good morning. I think Mr. McPherson is. Hello, Chair.
You're not very audible.
Can you hear me?
Yeah, it's not very clear though.
Hello.
Mantashe, continue. Mantashe, continue. Your line is not very clear. Mantashe? Okay. Can you try Mbuyane?
Chair, I was.
Oh. Mantashe?
Thank you, the President. Hello?
Mantashe, your line is still not very clear. Not very clear. Honorable Mantashe? Okay, let's try Mbuyane. We'll come back to Mantashe.
Mbuyane here, Chairperson. Thank you, Chairperson, for the opportunity. Let me first welcome the presentation.
Yeah, it's a bit low. Can you increase the volume a bit, Mbuyane?
Okay, Chairperson. I think I'm audible enough now.
Yeah, it's quite low, but it's fine. Try and go through.
Okay, Chairperson, I was saying I'm welcoming the presentation by the department. I'm having just few clarity-seeking questions, Chairperson, around the presentation. One will be the department should brief the committee in terms of company, especially big companies that are considering cutting investment, e.g. SAB. Then the other one is the impact. What is the impact of COVID-19 on the implementation of the investment commitment made in the conference, investment conference? Maybe, Chairperson, the other one will be the manufacturing sector has been hit hard by the lockdown, especially in the automotive industry. Chairperson, I just want to check, man, as to how will the department stimulate economic growth in the manufacturing sector? given the fact that this has been hit hard by the lockdown. What are the prospects or plans in finalizing the Africa Free Trade Agreement, considering that now we're in level 2, Chairperson? The last one, Chairperson, I just want to check because they say there are companies that they've been assisted. Can we get those companies that has been assisted by the department breakdown in terms of provinces? We also said IDC assisted companies, NEF assisted companies, but you are part of South Africa in Mpumalanga. I don't know anyone that has been assisted, a company that is producing PEE and so forth. So if you can get that breakdown in terms of those companies, Chairperson, I'll be very much happy. And the localization, maybe the local product or fair product chain, we're told that there's SARA certification and also those SAPRAS certification. I'm not so sure in terms of provinces, which companies are those, because we are told that companies has been assisted generally, but we have to know exactly, because we are heading constituencies, we must understand in Mpumalanga, there's anyone in terms of the company which produce PPEs, I mean to say, and also so that you are able to track and understand, Chairperson. Maybe the last one, Chairperson, the 100 proposal received. We just want to check in terms of the National Ventilator Project. They were received from local companies or the companies outside and so forth. And what is the view in terms of the 100? How many companies were able to be allocated with assistance to establish those things, Chairperson? I think that was the last one. But the last one, Chairperson, the commission, the Competition Commission. The last time I checked with the Competition Commission, Chairperson, they had challenges of not having tooth or teeth, because the 10% that they just give them is not enough, because big companies, they do what they do because they know they'll only spend 10% of their income and pay back in terms of the settlement. Can the department be able to review the act in terms of the Competition Commission and be able to give a Competition Commission a power to deal with these companies that they are not dealing with? Because this settlement agreement of 10% is not assisting us, Chairperson. People, they deliberately not taking precautions because they know they'll only take out 10% of their income in terms of settlement. Then, Chairperson, we want to check as to how many black industrialists, also companies that were assisted by this PPE production and also the health stock. That will be my last comment. Thank you very much, Chair.
Okay. Mantashe, I don't know if you are still contactable. If you can try again, and then I'll go to Thring, Honorable Thring. Mantashe?
Hello.
Yes.
Hello, Chair.
Try and speak up. Yes. Continue. Kubega says.
Can you hear me?
Yes. Try. Continue.
Chair, I want to rise. I am trying.
Mantashe?
To applaud the work that.
Mantashe, your line is still breaking.
Can we ask you to capture comments in the chat so that we can raise it on her behalf, Chairperson?
Okay. Honorable Mantashe, there's a suggestion that please do the issue on the chat. We'll try and actually facilitate that through. Can we then actually get Honorable Thring?
Thank you, Chair. Just had some load shedding and I've reconnected via one of my devices. So for the other members, if they're able to do that, that will also help if they have load shedding in the area. Chair, my questions are fairly straight. I asked the minister to look at assistance to some of our NGOs.
You can close your video so that at least you see. Let's hear how it goes. Continue.
Am I still clear, Chair?
It's much better now. Yeah.
Okay. I had asked the minister some time ago to give a list or to see what kind of assistance could be given to our NGOs. Now, I noticed that with the Competition Commission Tribunal and the fines to some of the companies and pharmacies and so on, that there were donations that were made to some NGOs. I have to date no feedback from the department with regards to other NGOs and whether some of those that I had submitted, and there's thousands of these NGOs who are doing incredible work on the ground to assist those who are in dire need. But what is the process? Some seem to be preferred above others. And I've had no feedback from the minister or the department with regards to assistance to those NGOs. My second question would be with regards to the National Empowerment Fund. What is our risk exposure? The amount of companies or industries that we are assisting that are still continuing to struggle because of COVID-19. So what is our current risk exposure, the number of companies being assisted and the number of companies that are in serious trouble? So could we have some stats on that? Chair, on the 200 billion loan guarantee scheme, I have a message from a small businessman who said, and I quote, "I've just been told by my bank manager that banks have been told that the backing for COVID loans is not fully forthcoming from government and the banks are on their own. The result is risk is having to be held by the banks, and as such, they are not making loans on reduced risk, but normal lending practices. Basically, the net effect is no COVID loans as risk are not government backed." So, we have all of this 200 billion loan guarantee scheme, but effectively, it seems as if our businesses, and particularly the small businesses that are in trouble on the ground, are on their own. So I want to know what is the interventions that are in place to ensure that the small businesses are indeed being assisted. I have on SAFM this morning, they indicated that just I think it was 14 billion rand of the 200 billion has actually been dispersed to small businesses. So certainly it's a fraction of the so-called 200 billion that are supposed to be there to assist our small businesses. So certainly I think that we have a case to answer, particularly with regards to our small businesses. With regards to the ventilator process, now I see that we're moving from the ventilator to I think it was called the CPAC, and I agree that the ventilator process is fairly invasive. But much like I think it was Honorable McPherson asked, it seems as if we were manufacturing these ventilators. Now we're moving away from the ventilator. So how many ventilators were in fact manufactured, and where are we in that particular process of moving from the ventilators to the CPAC, and how much has actually been spent on the project so far? And will those CPACs actually be necessary? Although I agree that they are actually better than the actual ventilators, which are far more invasive, because over 90% of the people that go on the ventilators don't survive. But how far are we actually in that particular process, and how much has been spent on the project so far? With our loss in GDP in the last quarter, and certainly I think the figures are anywhere from 5% to up to 15% in loss of GDP in the last quarter. But what systems are in place to work with other departments? Now, I also sit on the Department of Public Works and Infrastructure, and there is a huge, another entity called Infrastructure South Africa that has just been established with a huge drive to invest in infrastructure in South Africa. So what is the type of collaboration that is actually taking place, for example, with DTI, infrastructure development and other departments to actually ensure that there's seamless growth in terms of developing and growing our economy? I do believe also that the lockdown, the hard lockdown, was not necessary. We should have taken a path which is the path perhaps of Sweden, Switzerland, Taiwan. Very low infection rates. They did not close the economies down. They've kept the economies going, and they've come out almost unscathed. The economies have come out almost unscathed. So this seems to have been, I think, the hard lockdown, a man-made disaster on our economy. Thank you, Chair.
Secretary, I'm not sure if we still have actually.
There are more people, Chair.
Okay.
Mrs. Hermans, followed by Ms. Yaku, Chair.
Okay, Hermans and Yaku.
Thank you, Chairperson. Just on a lighter note, I think we must hold Honorable Mbuyane to when he says last, because he says last and then he still mentioned 3 other questions. So that's just on a lighter note. I have been
last,
yes.
last, and last.
And last, okay. Yeah. Chairperson, I have been largely covered by Honorable Mbuyane on the issues that he raised, but I want to commend the department